I'm Dr. Anjana Mackeen, and in this video, I would like to address some of the common queries pregnant women may have in these uncertain times. Novel coronavirus, SARS-CoV-2, is a new strain of virus that's causing COVID-19, which was first discovered in Wuhan, China, a few months ago. And since then, it has devastated millions of lives. And pregnant women are anxious and worried. And I would like to answer some of the common queries they may have. It is noted that generally, pregnant women are not exhibiting serious complications. They are mostly showing mild to moderate flu-like symptoms, and complications like pneumonia are more noticed in elderly or immunocompromised people or people with long-standing medical conditions. As yet, there is no evidence that pregnant women who get this infection can show serious complications when compared to an healthy adult. This is a very new virus and we are continuously learning about it. Miscarriage. Does it cause miscarriage? Well, currently there is no evidence that the coronavirus can cause miscarriage if you catch the virus while you are pregnant. The next is vertical transmission. What is vertical transmission? It is transmitting the virus from the mother to the baby while pregnant or during birth. Initial reports from China did not show much evidence of this vertical transmission. But there was one report from China, which was released on March 26, did show that there could be some evidence of vertical transmission. But this was just one case and clearly needs further investigation, and the medical bodies are continuously observing the condition to see whether this is possible. But I would like to emphasize that all babies who got infected soon after birth were very well. The next is developmental issues. Does this cause any developmental delays or problems in the newborn child? Well, given the current evidence, it does not show that the virus can cause such defects in the baby. Some babies born to women with symptoms of coronavirus have been born prematurely, but it is unclear whether the virus itself caused premature birth or the babies were born prematurely to aid in the mother's health. Well, the most important thing to do is you should follow the rules and regulations from the place that you live in. The rules may vary, but generally everything is put in place to reduce the risk of transmission. And some of the common things that I can tell you is regular hand washing. Use a tissue when you or anyone in your family cough or sneezes. Discard it and then wash your hands. Avoid public gathering. Avoid public transport. Don't meet your friends or families. Stay at home. Work at home if possible. And when you have a health-related concern, try to call your GP or your midwife first. They might solve your problem so that you can avoid face-to-face interaction with them to reduce the risk of this transmission. You might be wondering, as you're pregnant, whether you belong to a vulnerable group. Well, the Chief Medical Officer in United Kingdom has placed pregnant ladies in a vulnerable group due to caution and to make sure that they follow social distancing to reduce the risk of transmission for them. But as I said before, there is no evidence that the pregnant women may exhibit serious complication. We do know that some virus infections are worst in pregnant ladies. So it's better to be cautious as the amount of evidence is limited in this new strain of virus. If you are in your third trimester, which is after 28 weeks of pregnancy, you should be particularly attentive and maintain strict social distancing and minimize the contact with others. You might be wondering how to maintain your antenatal and postnatal appointments with the midwives or the doctors while also maintaining social distancing. Well, different strategies have been put in place by different healthcare systems. You might be having a phone conversation instead of a face-to-face interview with your doctor or midwife. The number of scans you might be having might be reduced to cater the need of the situation, and seeing your midwife might be a better option at times than meeting the doctor in a big hospital where your exposure might be larger. So all these communications should be in place and streamlined to cater according to the pregnancy that's going on. It depends whether your pregnancy is a high risk pregnancy, a moderate risk pregnancy, or a low risk pregnancy. According to the needs, your healthcare professionals should streamline your management to minimize the risk, but at the same time to not to compromise the care. And if you have an upcoming appointment, and if you think that you might be having some symptoms of the coronavirus infection like cough or sore throat or fever, you should communicate that to your healthcare team before visiting them so that they will be able to advise you accordingly. You visiting them at the time that you're having symptoms would put you and others at risk. And if you go into labor or if you have other concerns like reduced fetal movement, call your midwife team or your healthcare team or your GP to ask for proper advice before you visit the hospital. They may be able to guide you accordingly and to advise you when you should visit your hospital, with whom you should visit your hospital, and how to minimize the number of people you bring to the hospital, and how you should travel to the hospital to make sure that the risks for the rest of the population is minimized, and also at the same time taking care of yourself. So what if you get coronavirus infection during your pregnancy and then recover from it? Usually, as a precautionary method, a scan would be arranged to check on your baby about 2 weeks after your recovery period. You would be wondering, if you're having the infection or when you are in isolation, would that affect the way you deliver the baby? Currently, there is no evidence that a vaginal birth cannot take place if you are having suspected or confirmed infection. A cesarean section would only be offered if your health is compromised in any way and you have difficulty in breathing and the baby needs to be delivered soon. And currently, during labor, that there is no evidence why you cannot use an epidural or a spinal block if you need to do so. Also, using Entonox, which we call gas and air, for pain relief is possible if you are in suspected phase or in a confirmed phase of having this infection. As this is a new virus, there is limited evidence. A small number of babies were noticed to have this coronavirus infection soon after birth. So it is possible that this could have happened while the baby was in the womb. But whether it happened before delivery or just after birth, it is not certain. But your healthcare team would definitely make sure there will be strict precautionary methods and your baby will be monitored for any severing symptoms. Well, soon after birth, you might be wondering whether you can have skin-to-skin contact with your baby. Well, it's a choice that you need to make. In some countries, women with confirmed coronavirus infection have been advised to be separated from their baby for about 14 days. However, this may impair feeding and bonding. So the risks and benefits have to be discussed with your healthcare practitioner, and you need to come to a conclusion whether you would have skin-to-skin contact or would avoid that. Yes, you can breastfeed your baby. There is no evidence that the virus can be carried in the breast milk, and the well-recognized benefit of breast milk outweigh the potential risk of transmission of this virus through the breast milk. The main risk of breastfeeding is the close contact between the mother and the baby. If the mother sneezes or coughs, the droplets which is emitted can contain the virus and can lead to infection of the baby. When you or anyone else is feeding the baby, there are precautions which are recommended. Wash your hands well before touching the baby, the pump or the bottle. Avoid coughing or sneezing while the baby is on the breast. Try to wear a mask if it is available while you're breastfeeding. And after using the pump, follow recommendations for cleaning the pump well. And you can express your milk and give it to someone else who is well to feed your baby. Whether you are using expressed breast milk or formula feed, adhere to strict sterilization guidelines to minimize the infection. Thank you for watching the video. If you have any further queries, please feel free to email me or comment and I'll try to address them. Stay safe.